We are now live. Hello.
Welcome to Dubai.
Thank you. It's lovely weather at the moment.
So the nice white wall
Makeup.
behind us.
No makeup.
Well, I mean, I have a little bit of tinted.
Perfection. A little bit of perfection.
Yeah.
We are going to talk about makeup and spots.
Spots.
Makeup.
Yes. So you just had your makeup done, as you can see, not by me. Because that would
I
have
have well and truly been tangoed.
You've been speckled. So it's a little bit on the orange side.
It is a wee bit. It didn't come out orange in the photos, I'm pleased to say.
That's good.
Steve, the photographer, is quite magical.
Good. Is your hair going to go a little orange?
Possibly.
Okay. Well, the eye
Possibly.
makeup always looks fabulous.
It does.
It does.
On to
The
the subject.
subject at hand.
People wear makeup,
Yes,
or
they
they use something new, and then they get a spot the next day, and they say it was the makeup.
Yeah, so that's like one of the most common things people say, and it's totally inaccurate. I think incorrect might not be the nicest thing to say, but it's not completely accurate. So you can't develop a true acne vulgaris lesion a day after using a product. So that's not possible. But so
Because it doesn't give it enough time
to develop.
to develop.
Because so we have to differentiate between what we mean. Well, we have to define what a spot is. I think that's the first thing.
Okay,
So-
it's a big red thing that sits on your face.
Yeah. So but there's different kinds of spots. So let's use the Latin.
Come on, then.
So acne vulgaris,
Yes.
is common acne. So that's what the acne teenagers get, or whatever. That's the acne that we treat in clinic. Acne
Hormonal.
vulgaris. It's hormonally driven.
Right.
It's due to multiple problems within the hair follicle. So we think of it as a hair follicle problem. So the lining of the hair follicle is too sticky. There's too much oil. There's too much acne bacteria. It all gets trapped there together. That forms a comedone. Then as that comedone becomes kind of inflamed and grows, it ruptures into an abscess, and that's what we call a pimple. So that's
Right.
true acne vulgaris.
In America.
A pimple or a
Yeah.
spot in England. I was like, what? So it takes from a comedone to go into an acne lesion. It can take anywhere from a couple weeks to a few months or never. So a comedone can then revert back into nothing. So so comedones are pre-acne. They're non-inflammatory lesions, and they're the little bumps you see when you stretch the skin. Some people call them blackheads too, because they can be black at the top. Those are comedones. So those are pre-acne, and then when they become like a red evil spot, that's your acne vulgaris. What you can also get is little follicular papules or pustules, and that's what you get. Those are tiny little red dots that are at the hair follicle. They're little tiny ones. We call them monomorphic because they all look the same. So they're all the same size. So
Yes.
with acne vulgaris, your lesions can be different sizes. So if you've
Right.
ever had bad acne, some of them are
Yeah, they're
big,
big ones.
some of them are little
Painful
ones, some of them are painful.
Yeah.
So they're polymorphic. So they're poly meaning different. See, this is all my Latin and Greek coming out here. Polymorphic, different sizes, different shapes, even different colors. But with what
Get
you're
so
getting,
excited.
it's so exciting. So with an irritant, like a follicular irritation, you're getting something that's monomorphic. So it's they're all these little red dots. Some of them are little pustules that pus in them, and some of them are just little red dots. They tend to occur around the mouth area, which is classically what you get.
Yes.
Around the chin and around here, and if it gets very bad, we call that perioral dermatitis.
Right.
So all these little red dots. So if you use a skincare product or a cosmetic product, and a few days later or within 24 to 48 hours, you develop little red dots from them, especially on your lower face, that's more of a follicular irritation that's due to the product, but that's not acne in the true sense of the word, acne.
Right.
So that's what you have. So
That is. So I don't have acne.
you don't have acne.
I have these really annoying,
Tiny.
but they're annoying.
They're annoying, and they go away within like 24 to 48
yeah,
hours.
Yeah, even the next day, I'll have them in the evening. I'll put Vaseline on, go to sleep, and they won't be there. When
They won't be
I
there
wake
to work up. But like today, when you take all this off,
I'll probably have some.
you'll have some later
Yeah,
today.
but it won't have been the makeup that gave them to me.
It will.
Like the irritation.
It's
of
the
them.
irritation of the
So
makeup.
it could have been any product.
Any
on my
product.
skin, it's just been irritated.
Yes, it's
Right.
it's because they do a lot of like brushing and speckling
A
and all
lot,
that jazz,
yes.
and then they layer
Layers.
this primer and all this. Not that I've ever done this, but
Yes.
you know, all those layers of stuff.
Yes.
So you have all this layer of stuff, and then that can irritate the hair follicle. So it's not true acne. So true acne cannot develop in 24 hours. So that's what's happening with this, and you have this all the time, though it gets better every now and then. But before we started this live, you probably wear full on makeup 2 to 3 times a week.
I try not to, but sometimes yes.
Yeah.
If I'm going out in the evening, I do tend to wear something. Yes.
Yeah, exactly. So you do wear full on makeup a couple times a week. So you never let your skin kind of not have that time. So then
and you were saying I really need to do about 3 months.
I would say probably like 3 months, and then give you the treatment, because when you use the little creams I give you, it does help.
Yeah.
But then they tend to come back, because Caroline has flip outs if she's doing a photo shoot or something, and she has a couple of them, and then I'll get a WhatsApp, a barrage.
It's Diva here.
Yeah. So a barrage of pictures, and I have all these little spots. What do I do? What do I do? What do I do? I have to do a photo shoot. I'm like, Caroline, they're gonna Photoshop you, and they're gonna put makeup on.
I hate Photoshop though.
But they're gonna do it anyway.
I know.
It doesn't need.
So
You could have perfect, flawless skin, and they'd still Photoshop.
That is true.
So it doesn't matter.
No. Normal person
Yeah.
is going to get that even from a moisturizer.
No. So
No.
you wouldn't get it from just one product. But
Right.
if you're of the habit of layering your products, so if you're using some type of a funky 10-step skincare regime and you're layering 3 serums, using a toner, a mist, a moisturizer, and then like a sunscreen in the morning, and then putting makeup on, if you are developing these little monomorphic bumps, then you are getting a follicular irritation.
Because your skin is saying,
leave me alone. You're putting too much product on that is irritating, and it's the.
So can it not breathe?
It's not really that it can't breathe. I can't really explain that mechanism very well, but it has to do with the little hair follicles getting irritated. Kind of like when you know when you shave and your hair follicles, or when you laser or wax, the hair follicle becomes red.
Yes, it gets angry.
It gets angry.
Yeah.
Because you've ripped the hair out, or you've in some way irritated it. It's the same
Pissed
thing.
off hair follicles.
Pissed off. You're getting pissed off hair follicles because you're just putting all this stuff on, and it's like there's tons of hair. You have so many hair follicles on your face. You don't even know. You have no idea how many billions of hair follicles.
Plus, I shave before I have my makeup done.
Oh my god.
I know, but it gives a much better finish.
Okay, so that
No
doesn't
down.
help. No down. Yes, I do have down. Mine's being electrolyzed.
Yes.
But when I do that, I get follicular irritation that lasts for about 2 days from
Right.
electrolysis.
Yeah,
So
me too.
that's proper, irritating the hair follicles. Pissed off hair follicles.
Yeah.
And you can get pissed off hair follicles if you use too many products, and if you're just layering them on. It's just irritating, all these chemicals and stuff. So the way to manage it is to cut down on what you're using and let your skin, I guess, breathe. And I don't like that word.
No, but that's a sort of a normal.
Yeah, that's a normal thing to
person
say.
word.
Give your skin a break. So there you go.
So easy routine. If you have what you think is acne, then you should go and see a dermatologist.
Yeah, and then
Stop trying to cover it up.
stop trying to cover up. We can treat your acne, and I always recommend my patients continue using their makeup while we're doing their acne treatment, because it's known to make you more compliant with treatment. Actually, that's been studied. So patients who are allowed to use their makeup while they're undergoing treatment are more likely to get a good effect and outcome from their treatment. Because I couldn't tell someone with really bad acne to stop using their makeup while I'm treating their acne.
That's a hard one.
That's a bit harsh. Yeah.
What does that say?
I've tried various foundations and BB creams from various brands, and I will always get a spot or 3 afterwards. So don't worry at all. Why does that happen?
Well, I wonder whether it's in the same area.
Yeah, is it always in your lower face? You're probably very sensitive to just getting irritation, unless you're getting good going spots. So you have to also differentiate between whether it's these tiny little bumps that we're talking about with Caroline, or you're getting big old fat acne. Because if you're getting acne,
Big ones.
the big ones, if you're getting actual acne, then that's a different issue. Then it's almost certainly unrelated to your makeup. It's going to be a coincidence.
Okay, but the little ones are irritation, and it's not necessarily that tinted moisturizer.
Correct.
It's just a general irritation.
Just a general irritation. You just might not get on with that kind of product.
What's that one say?
You two have such a lovely and honest friendship.
How did you meet?
Oh, how did you meet? Well, Caroline's
I had a mole.
She's a patient.
Yeah, are you allowed to become friends with patients? Female ones?
Yes, you are. I mean, yeah. Yeah. But I think the GMC couldn't tell me I couldn't become. Don't be friends with your patients. Oh, okay.
Yeah, no, yeah.
But it was a long time ago.
Yes, it was. Couple of years? 3 years?
Probably 3 years. Yeah. I have pilar cysts on my scalp. How do I get rid of them? Well, you can come and see me, my dear, and I can cut them out for you.
What is a pilar?
A pilar cyst is an epidermal. It's like a hair follicle cyst that occurs on the scalp. And if you have loads of them, you can always come onto Skin A&E, and we can remove them for you for free. So
that's on Channel 5.
Channel 5. So if you want to be on TV and get me to remove your pilar
They don't have to be enormous to be on.
No, they don't have to be enormous. No, we like just to remove small ones too.
Do you?
And I will not cut your hair, don't worry.
No, that would be unfortunate.
Yeah, we don't cut hair when we do pilar cysts.
So what season are you on?
We're doing season 3. I'm filming season 3. Actually, they're filming some of it in November, and I'm filming my bit in January because I'm here. I have a long-winded question, Alfie.
Go on then.
All right, Alfie, hit us with your long-winded question.
I'm slightly nervous about scrolling because the phone might just twist suddenly.
Oh, we'll fix
It's
it.
not
Oh,
very
here we go.
secure.
Dr. Dre, here we go, said once that if you have an actively inflamed lesion, then you should avoid cosmetics in that area because the skin is more impaired in that area. Yeah, well, no, impaired. I think she would mean like it's more sensitive.
Is Dr. Dre a woman?
Yeah.
Oh, right.
Not Dr.
Not Dr. Bray.
Yes, and not Dr. Dre. Dre.
No.
So
that was not cool.
That was not cool. No, you should. So when actually I say the exact opposite thing, Alfie, because I say when you have an active inflamed spot, the ship has sailed. That lesion is on its way out. You can put whatever makeup you want on there. It doesn't really matter. But you don't necessarily have to actively treat it because literally the inflammation has settled in, and that spot is on its way out. It'll take about 13 days for it to settle down.
Oh, forever.
Forever.
Those bloomin' Vesuvius.
The Vesuvius, yeah.
Oh my gosh.
But...
And it doesn't have a head.
Correct.
So you can't do anything about it. And if you do, it's.
If you start to mess around with
off.
it, you'll have a big huge hole in your skin. Yeah, don't touch it. But yeah,
I'm 57. I've touched a lot. My eye makeup is amazing. Yes, it is, and I did not do it.
They always do great eye makeup.
Yes.
Natalia is in PJs.
Yes, she
No,
is.
this
Who
is
said that?
This is home loungewear. It's meant to be a loungewear.
Lower face. Oh, lower face. She says she gets
yeah.
lower face.
Not
bug acne. No one.
Oh yeah, just little irritating spots. Yeah, so
Yeah.
you're getting a follicular irritation from it.
So can you teach your skin to accept it? So if you kept using the same, so for example, Charlotte Tilbury, tinted moisturizer. If you kept using it, would your skin get used to it?
I don't know. You can try.
But it's not going to be irritated by that any more than
any other
Arborian or any
probably not. It doesn't.
So you just got to pick your poison.
Yeah, you pick your poison, or not use a product like that.
But I kind of think that that's the least of all evils. It's not a foundation.
So makeup is not my area of specialty, obviously.
No, but you don't wear foundation.
No, I don't.
You wear tinted moisturizer.
I don't think foundation and tinted moisturizer are that different. In composition, I'd have to check. But it's like all the same pigment.
I just think I'm doing better for my skin because it's lighter.
I don't know. We'd have to ask a makeup person that.
But it's less coverage.
Yeah, I guess it's less painty.
Yeah. So that makes sense.
I don't know if it makes sense. If it doesn't matter if it's less coverage. Mascara makes my eyes go red the next day, no matter how much I remove at night. Any suggestions of brands? Yeah. So this is a different problem now. So what I think may be happening for you is that you have an irritant or contact dermatitis to mascara. So what you would need to do in this situation, which is very annoying, is you need to have something called patch testing done. So then you would patch test to see by a dermatologist to see which chemical in mascara it is that's bothering you, and then you'll be able to buy the mascara that doesn't have the right chemical in it. So to be fair, most mascaras are the same composition-wise in terms of what they're made of. So I don't think that's going to be a huge issue. It sounds like it might just be an irritation problem though, because to have a true contact allergy to mascara, it would take you a few days of use to develop that. Because it's a delayed hypersensitivity reaction. An irritant reaction occurs virtually immediately, like within a few hours. But a true allergy is a delayed hypersensitivity, so it's up to 72 hours. So it depends a little bit also on what is your eyeball red, is the skin around the eyes red, is it itchy, like what are your symptoms?
Right. Definitely worth it, because mascara is something you would generally use every day. So it would be worth getting a patch test.
Yeah, and kind of seeing if what causes pyelorsis. Yeah, that's it. Please, what can I do to reduce my big pores?
Pores are not doors.
There's nothing much you can do except take oral.
I've got to get a t-shirt with that on it.
Yeah, that's you should.
Pores are not doors. It's one of my favorite little things you've ever said.
And I quote. Yes.
And I quote.
I quote.
What's the other thing that you say?
Retinol.
I am not wrong.
No, I do not argue. I explain.
Oh, so I haven't heard you ever say that before.
Oh, I've actually had it as
when
a post.
When have you started?
I had it as a post once. I do not argue. I explain.
Okay.
Yes.
I've never heard you argue, actually.
Yeah, I explain.
Any thoughts on retinol? We love
tretinoin. Yeah, we love tretinoin, but I think that's what she's asking. She. We love tretinoin, but the good stuff, not good stuff. What did you say about pores, please? Pores are not doors. You cannot close them.
But you can close doors.
No, pores don't have doors. No, oh, wait, what was the phrase? Oh, God.
Pores are not doors, is the phrase.
Wait, that makes no sense then.
That makes no sense. Uh-oh.
I think it's pores don't have doors.
Okay, let's go with that.
Yeah.
That's what we said.
That's what we meant to say.
Okay, but pores don't have doors, right?
Correct. You cannot
close them. They fill up with oil, and then do you extract it or do you leave it?
No, so the oil is actually in a constant flow. So anyone who has it, it's there all the time, and it just flows out at a consistent rate. So no matter what you do to your skin, that oil will there's an oil reservoir within the sebaceous gland, and if you remove the oil, it'll slowly just resurface, and it'll go back to the same rate it was before, because that's how your body functions.
And what about getting them extracted?
Pores extracted. Yeah. Well, you're just removing
which is then going to fill up again.
Yeah.
But it makes you feel better for a short period of time.
Yeah, if you do your sebaceous filaments or something, have them squeezed out.
Right.
But they take up to 30 days to refill.
But that can irritate them.
Yes, and you can get pimples from those little spots. Would silicone have any effect on skin? Not that I'm aware of, no.
Silicone, you have that in a lot of products these days.
Yeah, it's in everything.
And they go on very differently.
Silicone makes things kind of smooth. Yeah, well,
smooth.
I love this. Does Gua Sha work for facelifting?
Oh, yeah.
Should we say yes, it does? No, no, it does not.
I have a little bit of a dilemma with that.
Oh God, oh no, why?
Yeah.
Have we been using one?
We haven't.
Oh.
The royal we. We have not. But we may.
Oh God, did you get one?
I've been asked to try one.
Oh great. An expensive, fancy one, or just like one of those cheap ones on Amazon?
Quite expensive.
Is it a fancy jade roller?
Schmancy.
Did you get it yet?
At the end of the day,
yeah.
I don't want to say bad stuff about anything.
True, I do.
I say good stuff about good stuff.
Yes.
But I don't want to say bad stuff about bad stuff.
I'll see the box.
I would only say that for a short period of time, your skin it's possible that your skin can look better.
Okay, cool. A temporary effect.
Glowing, rejuvenated.
Where is this magical gadget?
And then it goes away.
Okay.
Until you use it again.
Can I try it?
60 days.
60 days?
Every day.
How much time every day?
Only about 5 minutes. It feels really nice if somebody is doing it.
Is it made of gold or something?
What was the product for retinol?
Oh, tretinoin.
Tretinoin, which is a retinoid.
Yes, the retinoic acid. There's a lot of stuff about it in my feed. Like, it's everywhere. Can you suggest a good derm in Australia? Yes, Dr. Ryan DeCruz in Melbourne.
Get you.
Yeah. Does makeup block your eye oil ducts? So that's interesting, because my I have all these eye problems. My ophthalmologist never said I couldn't wear eye makeup.
And he told you a lot of stuff you couldn't do.
Yeah, he told me I couldn't do anything. And he didn't say anything about eye makeup, because I have blocked oil ducts in my eyes. And he didn't tell me. No, I do. That's why I have to use those compresses at night.
Yes.
to like unblock them.
Yes.
And he never told me I couldn't wear mascara. And every time I've gone to see him, I've been wearing mascara, and he's never said you can't wear mascara.
Interesting, but you're not allowed to use lash serum.
Yeah, but that's because he thinks it's irritating to my upper lids.
I would be really sad if I couldn't use my lash serum.
I'm gonna he's not listening to this. I will probably use it again.
Yeah. Life's too short.
Yeah.
Good old Alfie. What's that say?
Sorry, so many things in my mind. Thoughts on pores and microneedling. Some of the literature I've seen says it can have a good effect. Yeah, I mean, you can try it. Alfie, as long as you don't have active acne, then go ahead and give it a whirl and let us know how it goes. I wouldn't understand why it would do anything for pores from a kind of a physiological point of view, but you know, the only thing we could do is have you try it, be a guinea pig. Maybe do half your face.
The laser closed the pores a bit.
The CO2. That
CO2.
Makes sense though.
So why does that happen?
What a couple different things. So we're affecting the top of your skin. So what am I trying to say? So the inflammation could temporarily kind of make everything swell a bit to make it look like the pores are smaller. But then also the CO2 is meant to have an effect on collagen in the dermis. And part of your hair follicle, which is your pore, it sits in the dermis. So if you tighten the dermis and kind of reconstruct it a bit, you would theoretically then strengthen what's holding the hair follicle closed. Because part of what's happening as we age, because having large pores is also a sign of aging, is because as we age, that tightness or the strength that's holding the hair follicle,
laxity of the skin,
allows the pore to open. Yeah, so that's why a CO2 laser can improve the appearance of enlarged pores.
So I'm gonna go and take all of this off, and then what do I do after that? Because I would clean it and then put Vaseline on it.
That's
and leave it.
Too. I mean, you could put what do you like to use, the Protopic or the what did I give you?
The wee one.
The cream, the little cream, right?
So it's like it's clear.
Oh, the metronidazole gel.
Yes.
Yeah, you could apply that immediately after.
And you can just buy that from the pharmacy.
Yeah, you can do. Here, you can.
DM me about the lash serum. I'll let you know.
Yeah, so you might in Dubai in the pharmacy. But there's a couple different things you have to do. But I would apply that immediately after this type of event.
What does that one say?
Minoxidil, why don't we see 5% for women on the market? It's because of the FDA licensing, but all my female patients use 5%, so I wouldn't worry about that.
You prescribe it?
Yeah.
You prescribe it?
Yeah.
There you go, you can get it. Is hydroquinone used only for melasma?
No, it's used for any type of melanocytic pigmentation on the face.
And it gets rid of it?
It gets rid of it.
No pigmentation?
Works its job.
Just don't go in the sun afterwards.
Yeah, because then I'll just come back.
Okay, thank you people so much for joining us at such short notice, and I will go and cleanse my face and
change out my pajamas. They're not pajamas, it's loungewear.
It's loungewear. Can we get one for men? What?
Minoxidil.
Minoxidil.
Yeah, it's 5%.
But also you can buy it over the counter. Rogaine.
Yes, you can. You can buy it over the counter.
Yeah. Okay, thanks everybody.
Everyone.
See you
Bye.
soon.
Good afternoon.
Bye.
Bye.